From NBC News, this is a special age-defying edition of Today. Getting up close and personal, very personal, with Kathie Lee Gifford and Hoda Kathie.
Well, we're going to be going through those procedures,
and especially one that you guys are going to be dying to know about. I think, as we teased it before, it's called cellulase. Cellulase is, you know, when you have cellulite in your legs or your butt or wherever, and you've been trying to get rid of it, but it's really difficult. Even if you work out a lot and you diet, you can't get rid of it. There is a new procedure that Dr. Nancy actually said on the air was actually very safe, she thought.
Yeah, with excellent results as well.
There is actually going to be somebody doing this procedure, and the way it works is, if you guys know what a mattress looks like with those buttons in it, it actually cuts through the buttons and separates the skin so there's no puckering. It's unbelievable. They're doing it close by.
Close by, so we're going to be going there. I think they're going to start it pretty soon. But all right, we got to go to Dr. Bruce Katz.
Now, Dr. Bruce Katz is in his New York office. He's about to perform cellulase on his patient, Colette. Hi, Dr. Katz. How are you?
Good. How are you, ladies?
Good.
We're fine.
I'm here with Colette.
Uh-huh.
We're ready to start.
Okay, so tell us what you're going to be doing to Colette.
Well, we're using this Cellulaze device by Sonosure, and, you know, as you mentioned, the mattress-like changes.
Colette.
She's not wearing Spanx.
You have these raised and, you know, depressed areas, and what we're doing is we're going to lower those raised areas by taking away the fat, and then we're going to cut those collagen bands that actually pull down on the skin and allow them to be released. And then the third thing we're going to do is stimulate collagen and tighten the skin.
So how quickly will Colette see some results?
Usually within a few weeks. Some people have a little bruising and swelling for a while, but it appears in a few weeks and keeps getting better.
Is it pricey?
Okay, well, you know, it depends on how many areas. A lot of people have a lot of different areas. I'm just going to start here, but you might want to turn away any viewers.
No, I want to see every bit of it.
Don't look.
I want to see it.
I want to hear Colette.
If you're squeamish.
Colette.
If you're squeamish.
No, don't
do it. Do it, Dr. Katz. Go.
No, don't look.
Yes.
Don't look. La, la, la.
Okay, we're
I told
starting.
you. Okay, Colette, can you hear us?
Colette, are you, okay, so you've had a mild anesthetic, right, on the area?
Yes.
Okay. Feeling anything yet? A little pressure?
Little tiny bit of pressure, but not much at all.
Oh, really? It doesn't feel painful? Okay.
No,
wow,
I feel pretty numb.
Okay.
Well, that's the key.
She's very numb.
I've got some numbing gel on my forehead right now, too, for the procedure that I'm going to have.
Wow,
so that really helps.
Here's what we're going to do. We're going to continue to check in and watch you, because this takes about 45 minutes.
Right.
That's unbelievable. It's happening right now.
I know.
I kind of got a little bit of chills.
It's happening all over the world, even as we speak. The cosmetic surgery and these kinds of procedures, which don't require the knife, are huge business.
Right. I mean, and I think a lot of people have tried to get rid of cellulite. Yeah. It's one of those things that sometimes like it just doesn't go away. It's genetic, and you can't get rid of it.
It's a weird. You just saw one doctor performing the cellulite removal process.
It's happening right now.
Cellulase. He's working on Colette there. We're going to check in on them in a little bit, but now we've got 4 more procedures to show you.
All right. Earlier we showed you Dr. Bruce Katz. He's performing the cellulite treatment called Cellulaze on one of his patients.
Colette.
It's this brand new thing happening. Tell us how's it going, Dr. Katz?
We're doing really well. Colette is doing well. She's just relaxing, I think taking a nap, actually.
You know what? We can't hear him. We're having a little technical difficulty, but it looks like it's going fine. Colette can't speak to us right now because she's turned over, as you can see. He's working on the other part of her anatomy.
Right. So
but it looks like it's going well.
Dr. Katz, can you hear us now?
I can hear you.
Great.
Can you hear me?
Yeah, we can hear you now, too. So are you about half done?
We're more than half done, actually. We're sort of in the final stretch. It'll be another probably 10 minutes or so. But it's going beautifully.
And just so for people watching, when you get this treatment done, is your cellulite gone forever?
Well, we've been doing this for over 2 years now, and the cellulite hasn't come back. So we're hoping that it is a long-term result, but we can only say for 2 years so far.
Okay.
And we should also point out that these procedures, although they're done widely, they're done everywhere, you really have to check with your doctor what something's going to cost. There are always additional costs as well.
And risks.
And risks. Yeah. So it can vary like crazy all over the country.
We're going to come back and check with you in a little bit, Dr. Katz. Meantime, a lot of people don't...
More than they say, but these guys are going to tell us.
Yep, Cellulase still at work.
I'm gonna go out.
want some.
And we'll check in with Colette, who looks like she's fine.
But before we do that, we're going to go across the street to Dr. Bruce Katz. You remember he was performing the Cellulaze treatment with Colette. Colette, first of all, how are you feeling post-op here?
Feeling all right. Surprisingly doing okay.
And is it completely done, Dr. Katz? She's finished and ready to go?
We're all done. She can actually walk right out of the room here on her own steam and go home, take it easy for a day or so, and then go right back to work 2 days from now.
What we're going to do, Colette, if this is okay with you, we're going to ask you to come back on Monday, and we're going to look at the before and after, okay?
And then maybe even 45 days later or whatever, and they said everything's perfect. So we'll check those thighs out.
You let me know.
Cheers.
All the best.
Let's look down the road.